Families are calling on state legislators for help. Those who have home health care for children with medical needs say they are struggling to find nurses to properly take care of their kids.
Yeah, and as RTV6's Stephanie Wade explains tonight, this is an issue impacting thousands of Hoosier families.
There are more than 14,000 patients in Indiana's Medicaid home care program right now, meaning that's how many families have at-home nurses to help care for their children with medical needs. But here's the problem they're running into: keeping good, well-trained nurses long enough.
Nails are so pretty.
This is 8-year-old Emma Geller. She has cerebral palsy. Thanks to the aged and disabled Medicaid waiver, she's able to receive home nursing care. Emma's mom, Annie, and her husband both work, so this is a huge help for them.
You get wonderful people, and they are so committed to what they're doing, but at some point it becomes financially not feasible for them anymore.
Annie says their home care nurses keep leaving for higher paying jobs at hospitals or other facilities.
That makes it hard. You don't have stability, you don't have reliability, so it comes to the point of, oh my gosh, I don't think we have a nurse today who's calling in sick to work.
In the past 6 years, Emma's worked with dozens of different nurses.
Oh, a lot. I would say probably at least 20 or 25.
In general, there are states that pay better than Indiana does.
Evan Reinhart with the Indiana Association for Home and Hospice Care says in some cases, nurses on the facility side can make double what home care nurses do. Do you think that the reimbursement rate right now is high enough?
No, it's not.
And legislators recognize it too.
We're trying to put more money into the hands and make so those home care providers can be competitive when they're competing against hospitals and other healthcare providers.
We're seeing much more of a response from the legislature. Now it's a question of, can we see some dollars put behind these services?
And if not?
My fear is that families like ours will lose care, and I don't know what we would do.
Stephanie Wade, RTV6.
Well, the legislature has already decided on the budget for next year, but the state also has a $2 billion surplus right now. Families are asking the Office of Family and Social Services Administration to dedicate some of that money toward increasing the Medicaid reimbursement rate for home health care. They have until June 30th to make that decision. If you feel inspired by this story, families urge you to call your state lawmaker.